So at BTOG this year, we presented our experience at Newcastle of using the Rockwood clinical frailty score within our lung cancer multidisciplinary team. So the Rockwood clinical frailty score was actually designed not for the cancer setting, it's designed to measure frailty in older patients when they're admitted to hospital and try and work out what their reserve is. We were one of 5 centres that worked with NHS Select to see whether this could help guide the care of our patients with lung cancer. And we've done this over about a year, and I presented our experience to date. We showed a number of key features. We showed that it could be done easily by any member of the MDT. So most of them were done by respiratory physicians when the patients were first presenting, but we also had oncologists, nurses, occupational therapists completing them, and the scores were very reliable and reproducible when we moved from one group to another. We then looked to see whether that associated with performance status, because this is what we normally use to guide our treatment decisions, and it did correlate with performance status, but did give us some extra granularity, particularly in a slightly difficult group of patients that have what we describe as a borderline performance status between 1 and 2, where we're trying to work out whether we should give them systemic treatment or not, whether they will tolerate it. So it gave us a bit of extra granularity in that setting. We then linked it to outcome, and we showed that in those patients who were frail on the Rockwood score, they were more likely to run into problems with their chemotherapy. So they were more likely to require dose reductions, dose delays, or be admitted to hospital with toxicity, and this has been shown by some of the other sites, including at this conference. And lastly, we looked at our patients who had been admitted to hospital, and we showed that those patients who were frail in hospital unfortunately had a really poor survival. So those who were scoring a high score of 6, their average survival was only 25 days. And that's important prognostic information to tell patients and their family that this is a sign that somebody's in their last days of life.